Hey everyone, it's Nurse Dani, and we are talking about breastfeeding today. It's so rewarding, it's so good for moms and for babies, but it can also cause a lot of anxiety, and a lot of women have questions about it. So today we have Ali Jones. She is a lactation specialist that works at Utah Valley Hospital in the NICU, and she's here to answer all of our questions about it. And while we're discussing, you guys are welcome to ask some questions live, and we'll get to as many of them as we're able to. So, Ali, introduce yourself to everyone.
My name is Ali Jones. I've worked in the newborn ICU at Utah Valley really since I was in high school. So I kind of worked my way up. I just work part-time as a lactation consultant now, and I love to help new moms and their babies figure out breastfeeding. It's fun.
It's really rewarding. Before we got started, we were talking about how we both had some negative experiences with breastfeeding with our children, but then we went on to have positive experiences. But I appreciate, and you were saying this as well, we appreciate those experiences because that allows us to help others. And we can empathize with some of the problems that people have with it.
Totally.
So I would say one of the most common questions we get is, how do I increase my milk supply?
Yeah. So moms in newborn ICU are at high risk for low milk production. And so we deal with that all the time. It's very common, but we like to get moms off to the best start. The first 2 weeks are the most critical to establishing a good milk supply. And sometimes actually the pump can be the perfect answer because it does a great job.
You don't have to worry about proper latch or any of that. You just pump.
Yeah. So I have had moms that have said, I really didn't have a good milk supply with my last baby. And I'm like, well, let's not jump right to there with this baby. Let's just do a good job pumping. And sometimes she'll have twice the amount of milk that she did on her first that she was just breastfeeding. So
like if a baby has a hard time latching or they're not latching properly, that leads to bad supply, other complications, the mother may nurse less and less. And that it's kind of like a vicious cycle.
Yeah. And I don't want any mom to be pump dependent. But pumps work great when you can't breastfeed your baby too.
Yeah, definitely. So for any moms out there who are wondering, the benefits are the same whether you actually nurse your baby or bottle feed if they're getting expressed breast milk. That's so important. Okay, so how do you increase supply? What would you tell someone who's actually struggling with it?
So I always want to make sure that they are stimulating enough, whether that be breastfeeding directly or pumping. We have to meet those needs. Your body needs about 150 minutes a day of stimulation to produce enough milk.
We usually talk about this when we talk about exercise, but now we're talking emptying the breasts.
Yeah, you need to be emptied every 3 hours or so.
Every 3 hours. Okay. And we kind of talked about this briefly before we started too. There are conflicting messages for moms who have just had a baby. We say, nurse your baby every 2 to 3 hours, but get enough sleep and eat and take care of yourself. And when you've got a baby to take care of, that's really hard. And if you don't take care of yourself, it may lead to depression and anxiety. And so what advice would you have for new moms?
Yeah, well, pumping moms, we can just completely schedule appropriately so she gets enough rest. On our NICU moms, we always recommend 2 4-hour chunks of sleep at night with just one pump in the middle.
Did everyone hear that?
But when you have a newborn, you can't always do that. So I always tell moms, like if a baby is cluster feeding in the evening for 3 or 4 hours, I'm like, the second your baby goes to sleep, you go to sleep too so that you hopefully get that 4-hour stretch.
And how would you advise moms to involve their partner so they can help them get more sleep?
Yeah. Daddies can totally help in the night. I mean, I don't want the daddy to take over a feeding because then I always tell the mom, well, then you'll wake up and you're so full that you're miserable or you'll leak and you'll have to wash all of your bedding. So I like the dads to just help the middle of the night feedings be quick and let the mom go back to sleep so he can help with diaper changes. He can burp the baby after so that mom can get back to sleep.
Because it may have only taken you 15 to 20 minutes to nurse or pump, but then it takes
15 to settle the
or
baby.
even like 45 because they won't go back to sleep. So they can take that shift and you can just go back to sleep. Okay, good advice. So when it comes to preparing for breastfeeding, is there anything that a mom needs to do during pregnancy to ensure that she'll make milk?
No, you don't have to do anything prenatally to prepare to breastfeed, like physically. But the best thing you can do is just take a prenatal education class. When I see moms that have taken my prenatal education classes in Mom Baby after they've had their baby, they're always the moms that are so much more relaxed and just feeling confident that they know what to do or when to worry or when not to worry. They're just way more comfortable.
Yeah, and if you have proper expectations about how it's going to go, a lot of people get concerned when the baby's born and they aren't producing milk right away. And if you didn't know that, that would be really, that would cause a lot of stress.
Well, yeah. I mean, that's one of the most common questions with some moms. They just say, I don't have any milk. And we're like, you always have milk.
Yeah, so
it's just varying amounts.
Walk everyone through that. What actually happens with milk production after delivery?
Yeah. So you're producing milk or colostrum in the breast like the whole last trimester of pregnancy.
And you may leak, but that's okay if you're leaking during pregnancy.
Totally fine.
It's not a sign you're going to be an overproducer. And if you don't leak, it doesn't mean you're not going to make milk.
Right. Yeah. So things just happen perfectly the way they're supposed to. And when your baby comes out, their tummy is only the size, of a little marble. And then by day 3, your milk supply's tripled, and it's the size of like a ping pong ball. And then by a week, it's the size of an egg, but it can stretch to hold, 2 or 3 ounces of milk at a time. So the milk comes in, and that's what slowly stretches the baby's tummy out.
Okay, that's really helpful to know. One of the other common questions that we get is, what about diet? How does my diet affect the baby? And are there certain things that I should eat or shouldn't eat?
Yeah. So they've done research where they had moms eat like large amounts of chocolate and garlic. And they actually just found the babies consumed more milk. They liked the different strong taste. So I always tell moms just a lot of variety. If you're just eating everything in moderation, most babies are great. Occasionally, we will have babies that have a milk protein allergy or intolerance. And that might show in a baby with like bloody stools, or they may have a lot of congestion, or they may have
nasal congestion.
Or they may have eczema on their skin. And if those things happen, you just need to talk to your pediatrician and see if they think cutting anything out from your diet may make a difference.
And so those are red flags. Bring those things up with them, and then they'll help you determine what you should do. And if they are doing a trial to see if the baby's actually allergic, it takes not just a day or 2 to cut dairy out. How long does it take?
Well, we usually say 10 days. Most of the time, if you're being perfect, though, a lot of dairy protein will be out of the milk in 2 or 3 days. But you have to really know how to read labels to make sure that you're really cutting it out.
So when it comes to how fast what we eat makes it into the milk, does it depend on the food or?
I would say, we usually say things are starting to pass through in 12 to 24 hours.
Okay, 12 to 24
And I know, I had one son and he had a dairy allergy, and it'd be 24 hours and he couldn't breathe. It'd have a stuffy nose, but he had the eczema from head to toe that went away when I cut out dairy. So
what about alcohol? Is it okay to drink alcohol when you're breastfeeding?
We usually say 1 drink a day, but you have to know, like what the serving size is. So it would be like a 12-ounce can of beer is usually okay. Or wine is only 4 ounces, or if it's a higher alcohol content, you really need to know your serving sizes. But 1 a day is usually okay.
And do you have to wait a certain amount of time between consumption?
They say to time it after, but the alcohol in breast milk is always going to match the mom's blood level. And so you'd have to know kind of how you metabolize alcohol.
Okay, that's a good tip.
Yeah.
So what about the composition of breast milk? Does what we eat each day affect the composition of breast milk? Like if I want to make whole milk, can I go eat a whole bunch of donuts and cheeseburgers and hope that my baby's getting whole milk?
We really just say if your diet is great in variety, your breast milk's going to be perfect. But even in countries where the women are really malnourished, their breast milk usually has the same fat content, the same, it kind of has everything in it. But what it will do is it will steal from the woman's body. So if a woman's malnourished, her breast milk, her body will do everything to make her breast milk perfect, but it might impact her bones more, or her skin or hair more.
So you shouldn't stop taking prenatal vitamins after you've delivered the baby. Yeah. You should continue to take them.
Vitamins great just to make sure you're catching everything.
Yeah, because I like to throw this out too, because women stress about the extra pounds that you put on during pregnancy, but that is by nature, literally by nature, because that's what your body draws from when you make milk.
I tell moms that your fat you gain during pregnancy, you turn into milk when you're breastfeeding. but it should be slow and gradual coming off. So my rule is you'll lose a lot of weight in that first month postpartum, and that's okay. It's baby, it's placenta, it's
Water
extra
weight,
blood volume.
yeah.
Yep. But after 1 month, it is a kind of a good gauge to figure out if you're eating enough. The weight should come off slow. About a pound a week is okay. If you're losing weight more than a pound a week after that first month, you really need to eat a little bit more so that it's coming off slower and more gradual.
How many calories should a woman eat in excess every day?
It's so different for everyone. Like my metabolism slows down to like turtle speed. I can gain weight so easy breastfeeding.
Some women do see it fall off, and those who don't hate the ones who do because
totally
they're like, I don't lose a pound till I stop nursing.
Yeah, everyone is so different. So that's my way I gauge if a mom's eating enough is how much weight are you losing every week after that month postpartum?
Okay.
If she's like, I'm losing 2 pounds a week, I'm like, then you need to eat more.
And make sure that it's nutritious food,
too.
Because it's tempting to be like, ooh, it's just falling off. I remember thinking this, and I was like, I can just eat a donut, and I can eat a cheeseburger. Obviously, I like these things, right? I keep mentioning them. But then it's true, like, if, a donut maybe has like 200 calories, but think about like a handful of almonds and an apple. That's so
way
much
better
nutrition.
Yep.
And you need to make sure you're eating nutritious food, too, not just calories, right?
Yep.
Okay, so when it comes to medications while nursing, what are some things that women should be aware about?
So especially for a preemie baby, we really want to know everything that the mom's taking, and we want her to let us know when she's making any changes or when her doctor's prescribing anything different. We want to make sure everything's okay for her little preemie. But most medications are compatible with breastfeeding. Occasionally, we will maybe if the mom's doing a new medication that she didn't take, and if she has some freezer milk, we might mix half fresh milk, half frozen milk, so that we're decreasing the amount of medication the baby gets.
Oh, okay.
That's what we do in NICU. We kind of engineer the milk so that we're lowering the dosage. But you just need to always talk to your doctor. And another great resource is you can also look online. There's a website by the National Institutes of Health called LactMed, and you can put in any medication, and it will pull up all the research that's been done with specific to breastfeeding on that medication.
Like what risks there are, what known side effects. Yep. Does it include the amount of time it takes to get to baby, or
it is thorough.
It's
what we use and our pharmacists and doctors use to make sure everything is okay.
Okay, that's a good tip. Yeah. What about herbs and supplements that might be taken to increase supply?
So we use herbs sometimes in our newborn ICU moms. I think herbs are safe, but we never recommend an herb. We just give the mom maybe some ideas of different herbs she could try maybe to boost milk supply, but we refer her back to her doctor to talk about those herbs with maybe any other medications that she's on.
Because we know that most of the medications that are on the market started out as some type of herbal supplement that was rigorously studied and went through testing, and they have effects on our bodies.
Yep.
And so when they're not regulated, then we can't guarantee like their purity or their efficacy. So it's good to make sure that they're not going to interact with anything else that's being taken or any medical conditions you might have. So what are some of the ones that you do encourage women to talk with their doctor about?
So the number one herb that's been used for thousands of years is a galactagogue. A galactagogue is just something that might help you secrete more milk, is fenugreek. And fenugreek, you have to take a lot of capsules a day. Like the standard dosing recommended if you're trying to boost milk supply is 3 capsules 3 times a day. And sometimes you can even go to 4 capsules 3 times a day. So when moms hear they're taking 9 to 12 capsules in a day, it might help them realize that if they'd tried it before and it didn't work, maybe they didn't get taught the right dosage. Because
if you're just taking 1 or 2, it's not going to make a difference.
Right. But there are also combination herbal products that usually fenugreek's the number 1 ingredient, and then they add some other herbs that may be helpful, like blessed thistle and red raspberry leaf, and there's just a lot of. But fenugreek's the number 1 ingredient. So the combination herbal products are more expensive. They can run like $25 or $30 for a bottle, and you're going through a bottle in 2 to 3 weeks. So if cost is a concern, I just recommend going with plain fenugreek because you can get it for $7 or $8.
Yeah, that's not bad. That's pretty affordable, especially if you're just looking for something to try.
Yeah. But your number one thing is always, if you're trying to boost milk supply, to boost your amount of time breastfeeding or pumping.
So when you say increase nursing sessions or pumping, how does that look?
Okay. I usually tell a mom, if your baby's feeding 7 times a day, I wouldn't really change what the baby's doing, but you might just add pumping after feeding for 5 minutes.
Okay.
So just a little bit extra pumping after just daytime feedings too. I don't want her waking up in the night to pump.
Yeah, well, you don't want to increase your milk supply in the middle of the night anyway, because eventually your baby will sleep through the night.
Yeah. But a common time I find moms reporting that their milk supply dips is when their baby's around 6 months old and they start to do more solid foods. Well, it's natural for the milk supply to go down a little bit at that time. But sometimes if the baby's eating more in the day, they sleep longer at night. And so your body may really react strongly to that. So if your baby's going down for bed at 6 months at like 8 p.m., but you're staying up till 10 or 10:30, I think that's a great time to just sneak a pump session in right before you go to bed, and you'll cut down the space. And that can sometimes help.
That'll give you a little bit of storage, too, in case you want to go out and leave some milk home with a caregiver. How else can you tell us about power pumping, too? That's something that can be helpful.
Power pumping is something we use with NICU moms all the time, but it makes one pumping turn into 3 mini pumpings. So I always tell mom, pick a really good TV show to watch and do 10 minutes of pumping and then a 10-minute break, 10 minutes of pumping, 10-minute break, 10 minutes of pumping. So in a 60-minute period, you're pumping for 30. The breasts do not like to be empty when you're breastfeeding. They want to be full. So if you keep them empty for an hour, they're going to speed up how fast they make milk to try to get full again.
It's so cool how our bodies self-regulate too, and how nature works, because when babies go through growth spurts, they want to eat more often. And then that stimulates the mother's body to make more milk, so that by the time they're 6 months, you can produce more to meet their needs than than your body did when they were a newborn. So power pumping is sort of kind of like inducing that without your baby having the growth spurt. Okay, that's really cool that our body responds that way. So sometimes complications arise with breastfeeding, like maybe clogged ducts, engorgement, mastitis. Talk about those for a minute and what it looks like and what women can do about it. Okay.
So most common time to get mastitis is like around 2 weeks postpartum, when your milk production's really ramped up. And I mean, I've had it happen to me. I just had it happen to a mom I was working with. She was about day 10 postpartum. And you'll just start to feel really unwell. I always felt it in my neck and head, and you'll just start to ache everywhere. And then the fever starts, and then you get chills.
Totally. That's what I got it too. And my husband actually woke me up, and he's like, why are you miserable? Are you like having a seizure? And I woke up and realized that I was sitting there shaking, and I didn't even know. And then, like you said, the fever and everything started.
So miserable. So you just need to really take care of yourself to try to prevent it in the first place. You need to be resting. You need to be hydrated. But I think that's why it's so common too, is that we're so exhausted when we're new moms. So try to take care of yourself, because anytime you're run down, that leaves you more at risk for infection.
And is it kind of like, does it build on itself? Like if you're engorged, then you might get clogged ducts, which lead to mastitis. So you kind of want to go back to to step one and prevent that.
You just really need to make things work. So feed your baby when your baby's hungry. They will usually when a woman gets plugged or starts a plug, they say research-based, it's not really leading to mastitis, but I disagree.
Yeah, because
usually a mom always has a plug before the mastitis starts. But you just really need to take care of the breast. So if you're starting to have an area that's not emptying well, really focus on feeding the baby on that side
and
first every
like a
time.
Lump or a tender spot.
Yep, just a tender spot. I feed the baby first on that side, because the baby always empties the first side the very best. So you might do that for a day or two. You might add a little bit of massage while the baby's feeding. Like, keep your eye on it.
And does heat help too? To kind of get things
We always use heat, and it feels good. And a common thing too, if you're plugged right now, a lot of people are saying that using an electric toothbrush, like the vibrating end, and doing that when they're breastfeeding or pumping, helps kind of loosen it up. To get it flowing better in that area. But if things aren't resolving, the earlier you get help from your doctor, the better. I've helped a lot of women that progress to abscesses, and usually it's because they didn't get on antibiotics soon enough. So
you have to call them if you're starting to feel sick, feverish.
Yep. Okay. And a lot of the doctors, nurses, I mean, they want to see you, but sometimes if you're on the weekend, they'll just call antibiotics in.
Based off of the symptoms that you're telling them about. Okay, we actually have a question live. Awesome. This is from Nicole. She said, what are some tips on breastfeeding while the baby has teeth or have teeth working their way through the gums?
Okay.
That's a game changer, right?
Yep. I nursed all my kids over a year, so I've lived through this. I have had them bite me, but I've read up. Best tip is when a baby is teething, they want to chew on something to get that swelling down in the gums. So before you ever latch them on, let them chew on something before. So let them chew on a cold teething toy, or you can even put your finger in a cold, wet washcloth and kind of massage their gums. Let them kind of gnaw on your finger so that they're not doing it here. Yeah. And then they usually will start biting when the milk flow slows. So when they're teething, you might have to just let them nurse when they're gulping, but the second it slows down, maybe end the feeding a little sooner.
Or they start to get distracted as they get older and they go,
yes,
and take you with them.
Yes.
And you only let that happen once.
Yep. And then you're finding a quiet, dark room.
To reduce distraction.
Yeah.
And so if they actually bite you, your reaction is usually like, and so I even had a mom say once, I feel so bad because I yelled at my baby.
And then they went on a nursing strike. Yeah. Sometimes that happens. Yeah.
So how should you respond to that?
So honestly, I mean, you're going to respond naturally. Yeah. And it's to stop the feeding and you yell, but just know they'll come back. Like even on a nursing strike, you may have to pump for a day or two, but just give the baby lots of loves. They'll come back.
Yeah. And does it work to I read somewhere too, where if you break the seal if they bite you and you just not yell, but you firmly say no. Yeah. And then you just take them off for a minute. Yeah. You put them back on.
That's great.
That just will kind of help move past it without incident. Yep. But they'll get the point.
Yep. Totally.
You might have to do it a few times.
Yes. And I am aggressively treat before you latch them on if they're teething because they just want to chew.
I like that preventive measure. That's a really good suggestion.
Yep.
So let's see. Birth control options while nursing. That's another commonly asked question.
So yes. I've read up a lot on this because I did not do well on hormonal birth control emotionally. But I've kind of always taught moms the LAM method of birth control, but I've gone in depth in that. You have to meet the 4 criteria or it will not work. But if you meet the 4 criteria,
which are what?
It's as effective as the mini birth control pill.
So we're talking breastfeeding being as effective as birth control.
Yes.
So what are the criteria?
The 4 criteria is your baby has to be under 6 months.
Okay.
You can't have had another period or any bleeding after the postpartum bleeding. You can't feed any more than 2 ounces of formula in a week.
So you pretty much need to be exclusively breastfeeding.
Yep. And then the baby cannot sleep longer than 6 hours at night.
Okay.
So I've had discussions with OBs and why didn't you give that as an option? They're like, no one exclusively breastfeeds.
That's kind of a good point.
Kind of why they don't teach it.
Yeah.
But, I know a lot of women that exclusively breastfeed. So.
But if they don't understand that the risk exists if they're not meeting that criteria.
Yep. But the World Health Organization does teach the LAM method, but you have to meet the 4 criteria for it to be 98% effective like they say it is if you meet the 4 criteria.
Yeah. And if you start to introduce solids earlier, like 4 or 5 months.
Then you cannot count on it. Yep.
Yeah.
Yep.
So when it comes to bleeding and nursing, when does the first period usually come back?
Highly variable.
Yeah,
highly variable.
I've heard as early as 7 weeks. Because you have to remember, the postpartum bleeding can last 6 weeks.
Yep.
And then anything after that you're seeing, you can start to track.
Yep.
And then you might see a little bit of spotting here and there. It could be irregular. You may see nothing, or you might actually have periods.
The biggest thing too is you can trigger a period by going too long without breastfeeding or pumping too. Anytime you go more than 6 hours, your body can be like, oh, I'm going to ovulate again.
You kind of think of it as missing a pill.
Yes. Yeah. Yes. So you have to be careful. But, when women are nursing close together, some women don't have a period for 8 months and 10 months.
Yeah.
But others, it's back at 2.
What about nursing while pregnant?
So that's called tandem breastfeeding, and it's common. I always tell a woman you may get a little bit more tender when you're breastfeeding, when you have a pregnancy going on. But as long as you're getting enough calories, it's totally fine to breastfeed while you're pregnant. They haven't ever found any risks that are, unless you were maybe in preterm labor.
Yes. If you had a preterm delivery.
And then you've got to look at it.
Because when you're breastfeeding, that actually can stimulate contractions.
Yes. You've got to look if you're worried about that. But if you're a healthy mom that doesn't have any risk factors, it's safe. But most women complain about tenderness. And at some point, sometimes the milk supply will dip down and the older child will lose interest.
So just kind of like the natural weaning happens.
Yep.
Okay, so it looks like we have another question live. I love these live ones. This one's from Emily. She says, my son is 10 months old, and I've been breastfeeding the whole time, and he has always spit up a lot after feeding, so I'm worried he's lactose intolerant. If he is, am I hurting him by breastfeeding?
So spitting, we usually, if it's just spitting, we do not worry about that with babies. Like some babies are just so spitty. So if they're happy spitters, you don't worry about it. As long as they're gaining weight well. If they have other symptoms,
it's all about having more in than what's coming out.
Yeah.
Right?
And if they have any other symptoms like worrisome stool pattern or the stool looks funny, it's worth talking to your doctor about. But most pediatricians just think if the baby's gaining weight well, no worries.
And spit up is not a sign of being lactose intolerant.
No.
Yeah. So there's like the other thing I would say to Emily is there's like a little mechanical hitch over the baby's stomach. And it's not fully developed till sometimes like 9 or 10 months.
Yep.
So it can inappropriately open at any time and
the baby irps.
And they spit up.
Yep.
So sometimes it just takes a little time.
Yep.
I love the term happy spitters.
Yep.
My son was totally a happy spitter, and he'd literally be sitting there like smiling, and it's like oozing everywhere. And I'm like, oh, another outfit ruined.
Yep, totally.
Okay, good question, Emily. Okay. This is a good one. What do I do if one of my breasts is smaller and produces less than the other?
So I teach moms both sides of our bodies are totally different, and you don't need to produce the same amount on both breasts. It's very common for women to produce twice as much on one side. So as long as both sides together produce enough to help the baby be happy and grow well, we're not worried about it.
You don't have to worry about this one making 1 and this one making 4. As long as together it's 5, and that's what the baby needed for that feeding. So how do you really tell that a baby's getting enough to eat? Because when you're breastfeeding, you don't see what goes in. You only see what comes out.
Yep.
So how do you know that they're getting enough?
Yeah. Breast milk's the easy in, easy out food. And so if the baby's just exclusively breastfeeding, if they're getting enough, they will show you in their pooping pattern. So I just teach the moms that they should have 1 messy diaper the first day, and it will be the black meconium. 2 the second day, and it's usually still black, but 3's a little bit of a transitional stool day. So it will change to army green or brownish, and they should have 3 on day 3. That's the day you go home from the hospital usually. Then day 4, it should show you straight breast milks coming out. So day 4, it should turn yellow. They should have 4 messy diapers. Sometimes it keeps going up from there to where every time you feed the baby's pooping too.
That's why you need all those diapers.
But as long as we have 3+ stools a day after day 4, usually the baby's getting enough to gain weight fine.
So what about looking forward to like 3-ish months of age, or even like 2 to 3 months when they may go days without a bowel movement?
I usually teach the stool pattern slows down at 6 to 8 weeks. So a little earlier, but sometimes it's longer. I mean, my kids kind of waited out till more like 3 months, but at 6 to 8, we always tell women if it slows down, don't worry. The baby's just starting to hold the milk in longer to pull more nutrition out of it.
Everything they're getting.
Yep.
Yeah. So
and they start to use it to grow. Yep.
Okay, so that's good. And what about wet diapers? Is it important to watch those too? It's kind of hard when they have diapers and when they're having bowel movements.
The stooling pattern tells you the most. But I mean, most diapers are wet all day long.
Yeah, so it's really hard to know.
Yeah, but the pooping pattern tells you the most.
But you may also know like what's normal for your baby, and when you change them and they've been asleep for a while, if it's been 3 hours and they have a dry diaper, that's unusual.
Yes, it is, and that's then you're going to be paying attention for the rest of the day.
Make sure maybe sneak in an extra nursing session. Make sure that they're hydrated. Okay, let's see. I love these questions. These are all so good. what if I had an issue with nursing in the past? Am I going to have an issue this next time?
So I felt like on my first baby, I barely had enough milk to get by. But my second baby, I had twice as much milk. I had enough to feed twins. So I always tell moms, let's not even worry about what happened in the past. Every baby, like, you might have a baby that just wasn't a great eater and maybe had some problems. But
sometimes milk production is circumstantial.
Every baby's so different.
So it's totally worth wiping the slate clean and trying it again.
Yep,
right?
Totally.
Yeah. Because we alluded to this a little bit at the beginning. We both had issues with some of our babies, and I had the same exact experience. I said to myself when I was getting close to delivery of my second, am I ready for all these breastfeeding problems again? And I thought, no, it's going to be okay. This is going to be different. And oftentimes you learn so much the first time that it just goes better the second time anyway.
Yep.
And he came out and literally latched on like a piranha, nursed him forever, and he was the best eater. His first words were boof. Well, and that meant food. I just knew that meant food. He's still to this day asking,
he's just a good
what's
eater.
For dinner after breakfast. So
he's a good eater.
Yeah. And I'm really glad that I had both a good experience and a bad experience to help women.
Yeah.
Okay. So is there anything else that you think women should know? What would be helpful for someone who's maybe pregnant and looking forward to nursing, or maybe has had a bad experience in the past? How would you encourage them?
I just think every baby, just give it a shot. And I always tell women if they've had a really traumatic experience maybe in the past, really relating to breastfeeding, give this new baby a chance. Try it out. Especially it's worth it. Like if she's always had a low milk supply with other babies, I'm like, let's just see what happens for a few weeks. And then I will help you wean if it's not worth your time investment.
Oh, okay.
So I just feel like I want to help moms give it a shot, but be very supportive if it's not working again. I just think every woman deserves the opportunity to have support, but also to talk with somebody that's reasonable.
Yes. That will consider both sides.
Yeah.
And weaning. How do you wean?
So
when it's time to stop?
I mean, honestly, it should just happen gradually and be really natural.
The worst thing to do is just a quick cold turkey, right?
Yeah, cold turkey is miserable.
Yeah.
But there are circumstances where I've helped moms do that too when it was necessary. So it's definitely not the preferred method, but we can do it if we have to and we're desperate. But I would way rather just cut out a feeding here and there. Usually if we have a mom exclusively pumping, we just drop one pumping every 3 or 4 days and we make sure she doesn't get plugged and just go really slow like that.
I noticed that the afternoon seemed to be the first time that dipped in supply. Is that typical?
It is.
I remember that was the first feeding I started dropping.
Usually when you
naturally.
rest, you wake up very full and it can kind of feel like it's dwindling as the day goes on.
But then back, when it comes to nighttime, then, I'd have plenty to feed the baby before they went to bed. So you say cut out a feeding every couple of days, slowly decrease the amount of time you let them nurse. And increase the amount of time in between nursing sessions till they've gone to whatever else they're going to go to. And that usually takes a couple of weeks in all?
2 to 3.
Yeah. Okay. So, and it's important to make sure they get what they need. While you're
while you're working on it.
Their needs with something else. So until a year of age, if they're cutting out, if you're weaning, what do they need?
Formula.
And after that?
After a year, they really say just see how it goes with whole milk. You just want to make sure they get plenty of fat because the baby's brain, it takes fat and protein to grow a baby's brain. So lots of fat. So you never want to use a low fat milk.
So if you were weaning, you might latch your baby on for a couple of minutes and then give them a bottle of formula to make sure they're full. That's kind of how it would look for someone. Okay, well, looks like we don't have any other questions. That has been so informative. Thank you so much.
I'll do one more plug. We do have an outpatient lactation clinic at Orem Community Hospital. We even see moms that come down from Salt Lake because from what I know, there's not an Intermountain outpatient clinic, but we bill insurance there. So I always think if you're having struggles, come and get more help from a board-certified lactation consultant.
Absolutely. That can be invaluable. And that one-on-one support of someone watching you nurse your baby and telling you things you can do to make it better and talk to you about what's normal and what's not. We didn't even get to this pain. This is something we've got to talk about before we close.
This is something I'm passionate about. Yeah. I mean, I had perfect technique. I'd helped thousands of women breastfeed. And on my 5th, I'm like, I am not going to get sore. And I still got sore. I did not just get tender. I got sore. So I just tell women, if you would express what you're feeling as soreness, not just tenderness, it's definitely worth keeping your eye on everything. But what I teach moms is if your skin is staying perfectly intact, your skin looks great, baby's getting plenty to eat, some women still have some soreness.
Yeah. It's going to just take some time for your body to get used to it.
But, if you get into skin breakdown, you definitely want to get more help because that can be a latch issue. But I knew I didn't have a latch issue. I knew my baby was getting plenty to eat. I still would say I experienced soreness, but my skin stayed perfectly intact.
And how long is it typical for that soreness to last?
I'd say up to 2 weeks.
Up to 2 weeks. And this would be like the first 60-ish seconds of a feeding. You want to like curl your toes and it takes everything to not rip them off kind of thing. And it may still be sore in between.
Yeah.
Yeah. Okay. Yeah. So that we can expect that. And that's
But
normal.
if you're worried about anything, just get more help.
Yeah. Have someone take a look. I think that's the best advice. Your pediatrician and lactation specialist. They should be your go-tos.
Yep.
And what's a good website for people to go to if they have breastfeeding questions?
So I use the website kellymom.com a lot. All the articles are written by lactation consultants, and they're very research-based. So I love kellymom.com. And a lot of places even referenced kellymom.com. So you may see another website name, but the articles are actually by the Kelly Mom lactation ladies.
So that's a good place to go.
Yeah.
Well, so many great tips, suggestions, helps for moms out there who have been breastfeeding. And maybe the best place to stop would be, what are the benefits to breastfeeding?
So, I encourage moms to learn about the benefits just so you have that motivator for the first few weeks. Like, I had a childhood friend that got type 1 diabetes when we were in 1st grade. And when I learned that babies that are breastfed for a year have half the rate of type 1 diabetes, that was my motivator. So I think learn about the health benefits. Pick one that's inspirational to you and that will help you get through the hard times at the beginning. But yeah, most everything, it's dose related. So the more breast milk the baby gets, the better the health benefits. But every drop of breast milk is advantageous to the baby.
Yeah, I mean, that's especially being in the NICU.
Yeah, we treat colostrum as medicine, and we don't use any formula in the newborn ICU. Like, we think breast milk is critical to a sick baby. So
if you make it 1 week, 2 weeks, 3 weeks, 4 weeks, however long you're able to make it, that's great.
Yep.
And my model at the end of the day, especially after having a hard time nursing my first, was formula-fed kids go to kindergarten too.
Yep.
If you end up getting to the point where you had to give it up for one reason or another, it's going to be okay.
Totally.
You shouldn't feel guilty about that.
Yep. Exactly.
Okay, well, thank you so much, Ali. Yeah. We really appreciate you joining us today. And hopefully some of you will have the privilege of meeting her and having her help you because she's just great. Awesome. We love her and we're lucky to have her in Intermountain. If you guys have any questions in the future for me, of course, you know where to find me on Intermountain Moms, Facebook and Instagram. Thanks for joining us and have a great day.